All right. Hey, everybody, and welcome to Interpreting and Applying GI360 test data. And this is something I'm very excited about doing. This is something I've been working on for quite some time. And wanted to share this with you guys, a very straightforward, simple way to interpret what is a complicated test. And we're going to get started with a simple presentation. I'll be speaking for about half an hour, and then we're going to have Julia join us and talk about case studies, and then we'll open it up for questions towards the end, okay? So what I'm most interested in right now at this point in my career is just, simple applications of complex lab data and skill acquisition for practitioners coming in. So we can take these amazingly complex and beautiful tests that are designed for us and apply them in clinical practice. So what I would like to do in terms of the next 30 minutes is show you how to interpret a stool test results and to assign patients into one of these three different stages. So you have a clear method of how you're analyzing the labs. And then we take a look at you interpreting a couple of these, and there's a few little slides I can show you that'll help you kind of start to get your mind around how that works. And then also talk about lifestyle changes and all of that good stuff that goes into this work as well. Okay, so first want to take a little detour here and a quick preface, sort of analysis of like, what are we doing this for in the first place? Why do we do GI testing, right? And that's a good question. And really the answer is that it's the heart and soul of functional medicine, isn't it? I mean, it's always been the kind of centerpiece of functional medicine is to do GI testing. And the complicated part about it is GI dysfunction can occur with or without GI symptoms. So when I teach at conferences and I'll say, I obviously can't do this right now because it's virtual, but, typical conference, I'll say, okay, everyone in the audience, I want you, put your hand up if you believe that GI dysfunction can occur with or without GI symptoms. People with their hands up, and then I'll say like, and how many people in the audience believe that health begins in the colon and that if you're healthy in your gut, you're going to have all your other body systems working pretty well, and everybody puts their hand up. And I'll say, well, how many people run a GI test on every new patient? And it'd be like 2 people out of 50 will put their hands up. We don't act according to our beliefs. If you really believe that you can have GI dysfunction with or without GI symptoms, and you really believe that a healthy intestinal tract and a healthy microbiome is required for a human being to be healthy, then you need to test everybody, And one of my goals is to make sure that each of us tests every single new patient with a GI panel. And the way that I was trained in functional medicine, Dr. Bill Timmons passed away a bunch of years ago. You could not talk to Dr. Timmons until you had done your GI panel. You couldn't even have your new patient appointment to talk to the doctor until you had done your GI panel. And that's how I learned how to do this work was, okay, that's what we do. You do the GI testing as an absolute requirement, not just on people that have GI symptoms. So if we're really treating underlying causes, don't just run GI tests on GI symptomatic patients. That throws you into symptomatic treatment. And what we're trying to do is elevate the conversation so that we're doing treatments oriented around underlying cause. So basically you need to test every new patient with a GI, right? And if you're going to start doing that, you're going to want to have some good ideas about how to actually deal with all this stuff because you're going to have a lot of tests. And so you need a system of analysis, and that's what we can talk about next. And so you have some conceptual framework to wrap your mind around. So here's how I look at it. 3 stages of GI dysfunction. They're progressive. Stage 1 is due to stress and poor diet, having this cumulative effect. There's a weakening of secretory IgA. There's a weakening of the adrenal glands. There's a stress component. There's inflammation, all the things that we associate with insulin problems and bad diet and the inflammation from all the poor foods that people are eating. And there's then also problems with microbiome diversity, right? And so that first stage is all about the microbiome not working properly. Stage 2, now things are getting even worse. Now the GI organs are being involved. Now you don't have enough hydrochloric acid. You don't have enough enzyme or bile production. Your pancreas is not working, your stomach's not working, your leaky gut is going to start to creep up at this stage, right? You're going to have damage to the gut lining. You're going to have a weakening of your gut immunity, and this is going to get progressively worse and worse. Then now we got organ involvement, and then eventually, if that goes on for long enough, people start to pick up pathogens, parasites, bacteria, or yeast. in a stage 3. So stage 1 is all about microbiome. Stage 2, the organs are involved now. And then in stage 3, there's pathogens that are, oftentimes need to be treated. And then the question is, where is each of your patients on this spectrum? Are they at stage 1, 2, or 3? Are they all 3 stages? And then what are you going to do in terms of treatment? So if you're looking at a complicated and intense test like the GI360, but you're just trying to figure out what stage the person's in or stage is, it allows you to wrap your mind around it in a little different way. It's a little less overwhelming. All right. And one of the most interesting things to be about functional medicine practice is that when you see people in the earlier parts of their careers, like the first 10 years, we all have this really complicated view of the world, and we think every patient is unique and different, and we design really complicated programs. I'm in year 28 now, by the way. I've been practicing 28 years. So that first 10 years, you're just like in it and you're loving it, and it's this depth of complexity is so interesting. But then when people get kind of old and cranky and they've been practicing for 30 years, 40 years, 50 years, I haven't quite hit that mark yet. They start to get really simple in the way that they approach things, right? And they have seen so much and done so much in their careers that they're really honing in on the specific, narrow little stuff that makes a big difference. And interestingly, the more sophisticated practitioners, let's say with 40 plus years in experience, end up doing really simple treatments. They might just work on a stage 1 microbiome type problem, even in a complicated patient. So you don't have to do the most complex treatments to get the best results. Stage 1 defined as a disturbed microbiome, low short chain fatty acids will show up on the test, and you may also have commensal bacteria imbalance. And this gets a little wonky and confusing because there's dysbiotic bacteria, there's commensal bacteria, there's like some bacteria that could be good or bad, like H. pylori. But what we're talking about for stage 1 is the microbiome, the good bacteria out of balance, or short chain fatty acid problems, or both. Okay, so that would be a disturbed microbiome. On the lab itself, how do you find that? Well, it's pretty easy. Look under the section for short chain fatty acids first. In some ways, this may be a little unfair, but in some ways, it's butyrate's kind of like the star of the show here. So butyrate, if it's low, and it would not to put down or denigrate acetate or propionate or valerate, but anyways, butyrate's kind of the main one that you want to focus on. But you should look at the others as well. And if you see low short chain fatty acids, that immediately triggers you and lets you know that there's not the full complement of the commensal or good bacteria. Because how do we make these short chain fatty acids? We make them, well, we don't make them at all, right? The bacteria in your gut make these short chain fatty acids from the bacteria digesting or breaking down fiber in your diet. So if your short chain fatty acids are low, by definition, you don't have a great complement of commensal bacteria. Okay, so that's one thing to look out for. Pretty easy to identify. Right away, you know the person's got a stage 1. The next thing, this is a little more complicated perhaps, but the lab has done their best to try to simplify this, is you look at the microbiome assessment page or section, okay? And it's honestly a little overwhelming to even name all the different organisms. This is a very complex area of science, and I don't think on any of us really, even someone like myself who tries to study this stuff day and night, has any kind of grip on the numbers and diversity of these organisms, right? You really would have to be a full-time just scientists just looking at this in and of itself. So what we're doing instead is looking at summary information, so you don't have to memorize each one of the individual organisms that they're reporting on. You're looking at a summary to see if there's an overall good or bad balance with the microbiome, right? And so they again present this to you in a graphic form here so you can see if the microbiome is balanced or not. And if you either have low short chain fatty acids or an imbalanced microbiome, then you're a stage 1. Stage 2, again, now we're progressing. The microbiome's been out of balance because of the bad diet and the stress for a long period of time. Now things are getting a little bit worse. The organs are starting to get involved. How do you figure that out? You can see that on the labs really clearly. Okay, and there's going to be maybe some more symptoms. Maybe there's no symptoms now at all, right? This whole process could go on without any GI symptoms at all, which is, I know, strange, but that's sort of, again, one of the premises of functional medicine is that we're not focused on symptoms. So markers of digestion, identifying a stage 2. You look at things like elastase. If that's out of balance, then you know that there's a pancreatic enzyme deficiency and that that organ, the pancreas, isn't functioning properly. Now, you're usually stacking these problems atop one another, right? So you've got a microbiome imbalance and the pancreas isn't working. And maybe the pancreas not working is making that microbiome imbalance even worse. You can also look at things like fat stain and see if the gallbladder is working. But these markers specifically are telling us about the functioning of the organs, okay? So organ identification or the stress that the organs are under. And this is pretty straightforward. If you have a pancreatic problem, you give pancreatic enzymes. If there's a gallbladder-related problem, you give gallbladder support, and so on. Okay, so stage 1 is microbiome. Stage 2 would be organs. The second part of a stage 2 is lower down, right, in the intestinal tract. And if there's markers of immune function or these inflammatory markers are out of balance, then you know that you also have stage 2, and it's affecting not the actual microbiome itself, which is stage 1, but now it's affecting the actual structures, the actual organ tissues of the physical aspects, the actual physical aspect of the body itself, whether it's the small intestine, the gallbladder, the stomach, the pancreas. And these markers here on this particular page will show you, is there an inflammatory problem, an immune dysregulation problem like with secretory IgA that's showing that the actual organ itself is not working properly. Okay, and that would be a stage 2. And then you support whichever organ is not working well, either with anti-inflammatories or with leaky gut repair products or with products that'll help the pancreas or gallbladder work more effectively. Right? Okay, then a stage 3. Now things have gotten really bad. The microbiome has not been working for a while. The organs gave up long ago. The leaky gut thing has been going on for a while. The immune system isn't working that well. And now infections start to occur, right? That weakened microbiome and the weakening of the organs allows either a new pathogen to invade and get a foothold, or for an old pre-existing infection to flare up, okay? And these two problems combined then have to be dealt with. You have to get rid of any of the pathogens as part of the treatment eventually, whether they're bacterial overgrowth or parasitic or yeast overgrowth. And usually if the person has gotten this bad and there's this much going on, you're going to need to kill something. Now, that was the way that I was trained, is that you kind of find stuff and kill things. And to me, and this may seem a little twisted and bizarre, but it's true. I really like killing intestinal bugs. I mean, it's not like I'm a mean-spirited person and I'm trying to eliminate life forms. It's just that patients get so much better if you find that they have crypto and you get rid of their crypto. It's just a really great feeling to get somebody better. And so killing of intestinal bugs is really, kind of one of the highlights of my practice day oftentimes. And so many symptoms get better when you get rid of these intestinal bugs that you really should become expert at identifying and treating GI pathogens. And again, to me, this is one of the sort of hallmarks of functional medicine, one of the sort of things that makes us a little different and unique is really wanting to make sure that we can eliminate all the GI pathogens successfully. Okay, so learning how to do that is important. And then in terms of the test results, pretty straightforward. Cryptosporidium positive, Giardia positive. You see exactly what's going on and you figure out what you're going to kill. Now, you may have to make some pretty important decisions here, like are you going to use antibiotics or are you going to use herbal antimicrobials, or which one are you going to kill first? Or, there's a lot of thinking to be done here. But the basic idea is that you've had a patient who had a microbiome imbalance, the organs got involved, the immune system got weak, they either picked up a GI infection or a chronic GI infection flared up, and now they're X, Y, or Z, right? Now they're tired, now they have a fertility problem, now they're depressed. Whatever the symptomatic expression is doesn't really matter. We're going to eliminate whatever bugs that we find and restore this immune system. And then, of course, we want to fix all these things. You want to get rid of all the pathogens, strengthen up all the organs, and make sure that at the end of the day, the microbiome is in a place that's going to maintain this person's health going forward. And that is obviously super important. So, quick summary of the stages. Right? Stage 1 is something's wrong with the microbiome. Either the commensal microbiota is out of balance, and you see it on these graphics that the lab has provided for you, pretty easy to identify, or low short chain fatty acids like butyrate, acetate, propionate. Either of those markers being positive, either of those areas being problematic, means that the microbiome's diversity and normal functions have collapsed. That's a stage 1. And of course, you want to fix that. It just depends on what order you're going to do it in, right? Stage 2 is now there's evidence of poor digestion, poor absorption, elastase is off, the fat stain, something wrong with carbohydrates. You're not having proper stomach action to make HCl. You're not having proper pancreatic enzyme output. And then horrible, your gallbladder's not working well, right? All kinds of chaos happens when the gallbladder's not working well. Or it's a little lower down, and you've got something like lactoferrin or calprotectin or lysozymes or SIG-A are out of balance, and you've got a degradation of the immune response. You've got an inflammatory process. You've got leaky gut. Okay, so stage 2, you're going to want to fix the organ. Stage 1, you want to fix the microbiome. And then stage 3, this disturbed microbiome, this failure of the immune system in the gut to work properly, and the failure of your pancreas and your gallbladder to work properly is accumulated. And now there's a parasite, there's dysbiotic bacteria, not commensal bacteria. Now we've got the bad bacteria, the ones that you want to kill, or you've got a yeast overgrowth. And you're going to want to take care of those in short order, right? And eliminate whatever the bugs are. And the tricky thing is, like, a lot of patients that we work with have all 3 of these going on at the same time, okay? And so you want to sequence it. And I think that's kind of to me, that's the artistry of the work and the artistry of program design is, okay, this person's got a stage 1, 2, and 3 going on simultaneously. Am I going to get rid of that parasite first or strengthen their microbiome first? Am I going to go after the gallbladder and get the pancreas and gallbladder working first? Or am I going to try to kill their yeast? Or am I going to do all 3 of these stages, treat them all 3 together at the same time? Or are you going to do a 3 and then a 2 and then a 1, or a 1 and then a 2 and then a 3? Okay, and the limits on this are, there's infinite possibilities here. And 100% of that, I think, decision-making process depends on the patient and where the patient's coming from and what their goals are and how sick they are, and on your confidence level and your understanding and your risk, what I call a riskometer, your ability to handle risk, because the more aggressive treatments have more likely, to result in side effects and problems you're going to deal with, but they're more likely to work, right? And so depending on your confidence level and where you're at in your career, and depending on what's happening for the patient, you may want to treat all 3 of these stages simultaneously, or just do a stage 1, or just do a stage 2 or 3. So you really have a bunch of choices there, okay? And now let's look again at a couple other examples here. So you can see here the dysbiosis index, and there's a score there. And you can, and all the labs are always classified like this, like red is bad, green is good. So you can see the dysbiosis index. This is a super helpful and very important thing. A lot of research time and money and effort of various scientists was put into making this little box here for all of us, okay? So if this score is high, it shows that there's a pretty significant problem with the microbiome being disturbed, okay? And that's something that we want to think about. Microbiome abundance and diversity summary, okay? So this is a summary of the commensal organism. So when you see the lab report, it's pretty intimidating. You're going to see page after page of these things that you can't pronounce, okay? And the scientists involved in this project here have taken the time to summarize everything for us in a really simple way, so you don't have to be a microbiologist to understand what's happening, okay? You'll see the diversity and abundance chart at the top. Looks like a spider web that's kind of pulled in funny directions, right? And then at the bottom, the dysbiosis index, that's going to show what the overall balance of the commensals is. And if that marker is way to the right, that gauge is way to the right into the red zone, then there's a problem, right? And there's a problem with the microbiome that you're going to want to treat if that dysbiosis index goes way up, all right? And then similarly here, easy to see, right? Cryptosporidium is either going to be detected or not. Giardia, these are just yes or no's, right? And so if you see those markers, you know that there's a pathogen or a stage 3 present. And then you can see also, we talked about low butyrate or total low short chain fatty acids are low. That would be a stage 1. Those are easy to identify as well. Okay. And then for stage 2s, lactoferrin high, calprotectin high, you're seeing a problem with the organ. So you're always thinking, the microbiome, is that good or not? The organs, are they good or not? And if not, which organs? And then pathogens, are there bugs? If they're bugs, is it bacteria, yeast, parasites? What am I going to need to kill? Those are the main decisions, okay? How am I going to support the microbiome if there's a microbiome imbalance? Which organ is affected and how am I going to support that organ? And then what do I need to kill? And if you just keep those things in mind as you look through these rather complex results, I think the labs will start to jump out at you and make a lot of sense, okay? So again, just to practice a little bit more, here's a patient that has low short chain fatty acids. So right off the bat, that lets you know that their microbiome is not doing well, right? Their microbiome, there's not enough good fiber, healthy fiber in the diet, so the bacteria are not breaking down that fiber adequately to make short chain fatty acids properly. Okay, so right off the bat, solution kind of jumps out at you. Stage 2, again, you'll see markers like secretory IgA low. That immediately lets you know that the immune response in the intestinal tract lining is weak. That's a problem with the health and integrity and functioning of the intestinal tract. So you've got an organ problem, and you can treat that organ. And then in a stage 3, again, these are yes and no's. These are, probably the easiest parts of the test in some way. Do you have an infection or not? And if you do, what are you going to do about trying to treat it? Okay. Again, these examples: low butyrate, low short chain fatty acids, high calprotectin, high lactoferrin, low Sig-A, Giardia, and crypto. Now, you often will get cases back like this where you have all these different things going on at the same time, right? And then you have to figure out, well, what are we actually going to treat here? And is there something that I can treat that's going to make something else get better, right? So I don't have to treat every single thing. Or in what order do I want to treat? Do you want to start with a stage 1 treatment and see if the microbiome correction is enough? Or do you want to start by killing things and work your way back the other way? I have a strong personal preference for killing things, but that doesn't mean it's better. And you certainly don't need to adopt my own personal quirky things. And I learned it from Dr. Timmons. It's worked well for me for 28 years. It worked well for him for 30 years. But no pressure here. You don't have to do it. A lot of the I'm just kidding. I mean, it really does work well, but I want you to be open to not doing what I'm recommending. Also, a lot of more sophisticated doctors would start with the microbiome, because the argument there would be, well, the reason why these pathogens are a problem is because the microbiome's out. So why don't we just fix the microbiome and see if that doesn't take care of the whole situation? Again, I don't do it that way, but I totally understand that as a potential argument. Okay. So now let's look at treatments, and leaving it alone for the moment, like which order you can do this in. If you want to know the order I do, I always kill things first, and then support the GI organs typically while I'm doing that, and then try to restore all the microbiome stuff at the end. I usually go 3 and 2 and then 1. I go backwards like that. But there are plenty of docs that do it the other way too. Okay. So in terms of specific recommendations, and what do I like this term I just made up, labs to lifestyle. I know, I just like the ring of that. But basically, we want to be sure that we include lifestyle factors in all this. And no doubt about it, I sell tens of thousands of dollars of supplements every month in my practice. And I'm happy to do that because they really work and they help people. But we always want to encourage people to do the right thing with food, because long term, we know once the supplements are done and gone, that it's going to be the foods that really make a difference. So if there is a microbiome imbalance, you got to talk to the patient about fiber, polyphenols, fermented foods, things that are going to encourage commensal bacterial growth. Long term, that's the correction, right? And they're going to encourage commensal bacterial growth and encourage short chain fatty acid production. So fiber in the diet, polyphenols in the diet, that's your blueberries and all that good stuff, and then fermented foods. So assuming that that's happening, that's 80% of the whole treatment, right? Then you can look at the fun stuff, which are the actual supplements, either prebiotic capsules or prebiotic powders. And most of these prebiotics are going to have polyphenols in them or some other combination of fancy stuff that's really designed for the microbiome restoration, right? Probiotics obviously can help quite a bit as well. And then butyrate is now available from a couple different companies if you just want to replace the butyrate. That can be quite impactful for a lot of different patients. Okay. And then if you're treating a stage 2, and again, we've all been doing this for decades, it's just a kind of different way of looking at it to have a framework. The lifestyle change is to make sure that people are taking a break when they eat, they're chewing their food well, and they're relaxing for 3 or 4 minutes after a meal. Those are the basic lifestyle things. And then depending on what the labs are showing, you may want to use betaine HCl, support the stomach, digestive enzymes, GI repair powders, glutamine-based powders. These can all help dramatically in reducing inflammation and getting the organs working better. And then the one that, I don't know, the one that it's always seemed to be, it's even on my slide here, it's like the last one, gallbladder support. You see how I put that last? It's like the gallbladder doesn't get any respect. It's so important. This is the one that everyone just misses. And you can even see it the way I set up the slide up. In my own brain, I still have this problem. Gallbladder is so important. If the gallbladder is not working well, you're just going to have all kinds of overgrowth of bad bacteria in the small intestine and SIBO type problems and on and on and on. So don't forget about gallbladder. And in fact, maybe if I redo this slideshow someday, I'll put that one first as like the headliner, because that one often gets neglected and people just space out gallbladder treatments to the detriment of patients. Okay. Now, if you're going into a stage 3 treatment, that's when I get more serious with the diets. I'm like, hey, you got to go gluten-free for real, or you got to do, a low FODMAP diet. You got to do something radical with your diet while we're getting rid of these gut bugs. Okay, it doesn't make sense to eat really poor quality food while we're trying to do some antimicrobial program. And so all the companies that we work with, all the different supplement companies have really great combination antimicrobial products, and you just want to make sure that you dose them up high enough. If you see like, super parasite killer X product from company Y, and you're giving like 1 capsule 3 times a day, I can guarantee you no matter what's in that capsule, that's not going to be nearly enough to take care of the bugs that we're talking about. So you want to get responsibly aggressive on your antimicrobials, okay? You don't want to hurt people. You don't want to send people to the emergency room with their liver not doing well. But at the same time, 1 little dinky capsule 3 times a day never eliminated the crypto, okay? You got to get responsibly aggressive with the actual treatments themselves. And then, so I do a combination of these things, right? So I'll do a combination product along with 1 or 2 single antimicrobial agents at the same time. And those are listed up there on the board. You can choose whichever ones are your favorite, and some people actually will, pick based on sensitivity testing and whatnot. I don't do that in my practice, but a lot of people like to do that. Now, in terms of protocols, and I know protocol is maybe not the best word, so maybe we should say program, or what approach should you use? Do you want to start with treating a stage 1 or stage 2 or stage 3? Where do you want to intervene? Most of the time in my practice, I'll treat the stage 3 if it's there. I'll eliminate the bug while I'm supporting the organs. That's my typical approach. And once the bug killing is gone, is done, that phase is done, usually takes 2 months, sometimes longer, then we'll do the microbiome restoration towards the end of the program. So I'll do, for example, leaky gut repair with gallbladder support and digestive enzymes while we kill the crypto. Once the crypto killing part is done, then we'll do all the microbiome support. That's usually how I do it. Some practitioners, some very advanced practitioners, as I mentioned earlier, and some beginning practitioners are happier to treat the microbiome part first and seeing what benefit they can get from that. The more sick a patient is, the more you probably need to get in and treat something that's going to make a bigger difference. Usually that means eliminating bugs. Some people can't handle the actual killing of bugs, right? Those supplements are just overwhelming. So you may have to step it back to a stage 1 treatment if they respond horribly to a stage 3. There's also cost considerations. Some of these supplements can get quite expensive. And then also, like, what's the patient's preference? I'm always dialoguing with patients and saying, well, you've got a microbiome problem, your gallbladder's not doing great, and you have Giardia and crypto. What's your gut feeling, no pun intended, on what we're going to do? Some people will have immediate opinions on this. They'll be like, this is so gross, I want to get rid of that crypto. Can I start like today? Or they may say, well, I don't know, I'm a little sketchy on this whole thing and I don't want to get sick. Can I just do the microbiome thing first, right? So talk to the patient and interact with them. And as you're starting to design these programs, I think that's one of the biggest things I've learned is that if I take the patient's preferences into consideration, I look at the bigger time frames to all this, then the programs go really well. And I think almost all the mistakes I've made over these years have been a lack of talking to people and really being clear about what their goals were, and just proceeding with my own agenda. Okay, so you have these 3 different programs you can use: stage 1, stage 2, stage 3. There's much more specific information in this GI masterclass that I put together for you all. So if you want to get more specific about like what supplement and what's the dose and what companies and this kind of stuff, then we have a GI masterclass. And for some ridiculous reason, we're offering it for free, so you don't even have to pay for it if you're listening to this. Usually we charge for this class. And I guess the coupon code is GI2020. Okay, and so in the class, you'll hear a reiteration of what I talked about here, but a lot more detail. And then I did a bunch of case studies and actual application with real supplements, so you can learn a little bit more about how all this stuff works. And we've had hundreds of people listen to this GI Masterclass now, and it's been pretty popular. So I think, if you're curious about a subject and you want to get a little more granular, a little more information on it, it's probably worth your time to take a look at this. And coupon code is GI2020. And if you're listening to this, go ahead and check that out, and you can give us feedback at the Kalish Institute. We're always interested in how you guys feel about our courses and how all of this stuff is working for you. And my main goal in life right now, because I'm kind of old, how old am I? I just forgot for a minute how old I am. Maybe that's a sign of getting old. I'm 55. I was going to say I'm 58, but I'm not. I'm 55. I'm almost 56. And at this point, I'm as old as my teachers were when I was a young doctor at age 30, And so it's like my main goal now is to do what they did, which is just to give back to the docs that are learning this work as much as possible. And that's really what the Kalish Institute is about, okay? All right, so I'm going to wrap it up now for my portion here. And I think I'm going to stop my share and let Julia pick it up.
Hello. All right. Thank you, Dan. That was some wonderful information. And now we will continue on with this information about the testing and specific GI360 cases that will hopefully provide some greater understanding so that you can utilize these testing within your clinical practice. Let's begin. Our first case is an interesting case. This is a case of a patient who was under the care of a psychiatrist. And this patient's chief complaint is lifelong depression and obesity. Within the past 3 months, the patient has decided to switch to a less processed food diet in an effort to curtail the lifelong obesity. And the psychiatrist actually ran the GI360 due to the chief complaint of depression. This patient was also previously treated with antibiotics, 3 rounds, for H. pylori. Let's take a closer look into the colon here. So here we have the first page of the GI360. This information here, this first cursory information, we'll go over this beautiful hexagonal graph here, and we can explain that. Once you understand how to use the hexagonal graph, you will be able to do that very quickly. Quick look and get more information detailed as you go through the test. So this hexagon here, it should be right within this one line from the exterior. So the gray line there that has green underneath it, that would be what you're looking at. That would be the perfect shape. It would be a perfect hexagon, and that would denote absolutely perfect abundance and diversity. Now, if the white web area, this is your patient's result. If this is really skewed in, that's going to be right off the bat, you're going to know low abundance. And if it's really skewed to any one of the specific phyla, you will know that that is diversity is off, and you can address that accordingly. So we see here for this patient, Bacteroides is a little bit higher, Actinobacteria is a little lower, Vermimicroba is Vermimicroba is actually perfect right here. Tourniquetes is a little bit lower, and these Proteo a little higher here, and the Firmicutes is a little bit lower. So with regards to diversity, we can see there are some issues here. And with regards to abundance, we can see generally that white surface area there, it's pretty comparable to what we'd expect with that perfect hexagonal shape here. So abundance is looking okay, but diversity is definitely looking dysbiotic. And we'll go to the next step and get more information about that. The next step we see here is the Dysbiosis Index score. Scores of 1 and 2 are associated with normobiosis, and scores of 3, 4, and 5 are associated with dysbiosis, IBD, IBS, and so these are deviations from normobiosis. And this is great information here to help your patient. It's a wonderful tool here to see that score, and it's also a very strong clinical marker. Now, a little bit more information here, moving a little deeper into the test. We have the key findings here. The first page here is the information that is found on the PCR technology. So this is the DNA testing looking for the specific bacteria which have been proven to differentiate dysbiosis from normobiosis. You can see here this patient has quite a few significant findings, and that does correlate with the dysbiosis index score of 5. So we know now that this patient has a dysbiotic gut, and now we know exactly why. So we can see here and go through these specific bacteria, and that's the first column. The second column here, just to get you orientated to understanding the interpretation, the second column here is the other significant findings within the test. Okay. So here we'll talk about a few of the species here. The patient does have a Diasterin vistus and Megasphaera micronephorums elevated. That species is associated with endodontic pathogens. It's also associated with spondyloarthropathy. This patient does not have a diagnosis of spondyloarthropathy, but I have seen previous tests with patients that have been diagnosed with spondyloarthropathy, and they do have elevated Megasphaera, so that is intriguing. Secondly, we see the patient has a very high parabacteroides. Now, this is interesting because this species is actually associated with body weight. So this could be a contributing factor to the patient's chief complaint. Now, the other thing to consider here, it's also associated with the standard American diet. Most likely that has been the patient's main diet. I know they said they switched to a healthier diet recently, but they probably do have a history of a standard American diet. There is another species in here that tells us about that. The Giardia species is high. That's also associated with the standard American diet. So we do have those two here. The next thing we see here is the Eubacterium cerium is very low, and the next thing we see is the Fusobacterium protenitzii is very low. That bacteria is a key one in the gut. It is very healthy within the gut. It has anti-inflammatory effects. It is very healthy for the mucosal barrier, and it's also a strong butyrate producer. So the fact that the patient is low in this is going to lead the patient to be at risk for inflammation and inflammatory cascade of events within the colon. Additionally, for this patient, Fusobacterium protenitzii very low is actually been shown to correlate with major depressive disorder. So the patient's chief complaints of lifelong depression and obesity are seen here with 3 of the bacteria, specifically the Fusobacterium protenitzii and parabacteroides and the Giardia. So that's very interesting. Moving on here, the patient does have low actinobacteria, low all stripes bacteria, and Bacteroides fragilis is high, and the Giardia species are high, and that's going to be contributing to the dysbiosis. Additional markers we see here, the fat stain is high. Is that a dietary issue for the patient? We know they said they're eating healthier. Maybe not though, because we do see the species associated with the standard American diet. Is that a GI dysfunction, like Dan explained with the phase 2? We see the patient does have high propionate and does have higher valerate, and that's likely due to the dysbiosis that we see here with the specific bacteria. And then we see a high fecal secretory IgA. So we'll talk about that in a minute. Oh, I apologize. So with the high fecal secretory IgA, that is associated with a GI infection in the past 4 to 6 weeks. So you'd want to get a good history on the patient to make sure they haven't had a GI infection in the past 4 to 6 weeks. In the absence of a GI infection in the past 4 to 6 weeks, you would consider potentially a food sensitivity, and that could very likely be a factor for this patient. We don't have that information. So this is a great case, and you do have some clear things here to see for the patient. Now, with regards to, we do have these 2 species that are strongly associated with standard American diet, and we'd liked the Parabacteroides and the Giardia, and so we'd recommend a dietary intervention for the patient. For the F-Protnitzi being very low, we would recommend inulin. That has been proven to increase that species. So some things to really help the patient here. Now on to our second case. This is a different case. This is an interesting case here. This client's chief complaint is ongoing joint pain, hypothyroid, chronic constipation, and diarrhea. And that has gotten worse within the past few months since a trip to Hong Kong. The patient is also on some pain medicines due to a bike accident in June, and that was a few months before this test was taken. Okay. So here we see the web again, and you can see very clearly that this diversity is skewed to the proteo. Very quickly you can see that. The proteobacteria group is a group associated with inflammation, and so the fact that you can just look at this right away and see, okay, the diversity is skewed toward inflammation. We have a dysbiosis index score of 5, so the patient does have a dysbiotic gut, and this is a really patient-friendly, user-friendly forum here. You can discuss this with the patient very easily and track and monitor their progress. Now here we see the detailed information regarding this patient's microbiome. Proteobacteria are very high. Those are associated with inflammation. Clostridia class are very low. That's a broad group, but generally beneficial. So the patient could use a dietary intervention here of soluble fiber, chickpeas, things of that nature. Streptococcus is very high, and that's going to be potentially associated with inflammation. Bacilli class is high. The Bacterium serum is low. And then we see the Lactanospiraceae is low. Okay, and that is a butyrate producer as well. And so the patient is going to be at risk for low butyrate and inflammation. And we do have a higher Streptococcus and a lower Vianella species. The Vianella species is an interesting species. It is associated with IBS and the gas and bloating and pain of IBS when it's elevated. Not the case here, but interesting to note. Now, moving on, we see the next thing the patient does have a Salmonella species cultured. So that's the beautiful thing of this test. We're doing culture and DNA in one test. We see the Giardia duodenalis is here as well. Citrobacter is here as well, cultured. I apologize, the Salmonella was from DNA testing. The Citrobacter is cultured, the Klebsiella was cultured, and the Geotrichum yeast species is cultured. Lactoferrin is very high, and secretory IgA is high. So in this case, it's intriguing that the secretory IgA is high. We do want to consider that the patient does have these enteropathogens, and so this is actually an appropriate response. So that's a healthy response. And as Dan was talking about the different functions of the gut, this is a healthy response actually. So that is good to see. Now here we have the information about the pathogen portion of the test. So this is using DNA technology to identify viruses, pathogenic bacteria, and parasites. And we see here for this patient, they do have the Salmonella and they do have the Giardia. So this finding right here can very well be the factor with the patient's chief complaint of worsening diarrhea and GI issues for the past 3 months since travel. Okay. Next thing we see here is the culture, and this is a beautiful information here because this is the culture, and we have the Citrobacter has been cultured, and the Klebsiella has been cultured, and we do have a culture of a large amount of yeast. Yeast at a moderate amount within the colon of +1 is considered normal. Although when we do have the yeast here at this level, it is considered too much within the colon, and that's going to be a problem. And so we would like specific treatments for these two dysbiotic bacteria and then this yeast. These dysbiotic bacteria, especially the Klebsiella, can be the cause of the patient's chief complaint. Klebsiella tends to be pretty symptomatic for people. But again, this is a patient that you'd want to work on this, do treatment, and then retest. Okay, let's see here. Now, with regards to treatment, what we would recommend is actually, if you're going to use the natural agents, to use the top 2 for 4 to 6 weeks. And if you're going to use the prescriptive agents, you can use 1. So this is the excellent aspect of the GI360, is that you can have the sensitivities to these dysbiotic bacteria because they were cultured in the lab. So you have the PCR technology with that dysbiosis index, and then you have, which is a more chronic, as we could see, specific to the patient. And then we have this Citrobacter and Klebsiella cultured with these dysbiotics, so you can help your patient right away specifically for them. These are not wall charts. This is the bacteria that was cultured for your patient specifically in the lab. So it's very individualized treatment. Now, so top 2 for these two, let's see here. We have silver, grapefruit seed, uva ursi, grapefruit seed, and silver. So you could, uva ursi is a third here. So you could use any of those 3 together for 4 to 6 weeks. Retest. Recall the patient did have an elevated lactoferrin, and that can be due to these enteropathogens that we found, the Salmonella and the Giardia. So you'd want to retest this patient and see where they're at, see if these species have resolved, and check to see if the fecal secretory IgA has gone down, and monitor that lactoferrin as well. All right, so here's our next case. This is an exciting case. So this is the case for the patient that is on a ketogenic diet. And this is interesting because ketogenic diets are becoming more and more popular within popular culture now. So this patient is on a ketogenic diet. They do not have a GI history. And as Dan explained, you don't want to wait until the patient has a GI complaint to do the testing, and this is a perfect example here. So the patient does not have a GI history. They did develop gestational type 2 diabetes, and so they're avoiding the carbs to avoid the hyperglycemia. So that is the reason for the ketogenic diet. And here we see their GI360 results. So right away, the abundance and diversity, we can see that this is very skewed to the Vermicroba. We can see that the proteos are a little bit higher too, so potentially some inflammation as well. We can also see that they're lower in the actinos and the Firmicutes. Within the Firmicutes is the very beneficial Clostridia class. And so the patient is going to be at risk for decreased butyrate and inflammation, and we'll go into that a little bit more. But so we can see very quickly that this patient does have a dysbiotic gut. And to further expound upon that, we have the dysbiosis index score of 5. So definitely this is a dysbiotic gut. The key findings that have constituted that is this Akkermansia muciniphila, very high. And that's interesting because this is a very important marker within the gut, this bacteria. It consumes the mucosal barrier. And so when it is elevated like this, the patient is going to be at risk for decreased mucosal barrier, increased inflammation, potentially increased intestinal permeability, and cascade of inflammation. This patient's also low in the F-protein, so that is a key butyrate producer. Again, the patient is going to be potentially low in butyrate, at risk for inflammation. Then we have a low actinobacteria, low bacilli class, low Lachnospiraceae, again, another butyrate producer, Vianella species low. Additionally, we have this Candida albicans cultured, so we do have yeast cultured. Higher pH, we're thinking that this was a stagnant colon. Clearly, the patient is avoiding carbohydrates, and they probably are avoiding beans and things of that nature. And so therefore, they're at risk for low soluble fiber, low beneficial bacteria, low butyrate, and then higher pH and constipation. We do see elevated propionate, low butyrate, low total short chain fatty acids, and very low secretory IgA. Let's take a look at that here. So here we get a better look at the ketogenic diet and butyrate. Look at this here, butyrate's very low, low total short chain fatty acids. So is the ketogenic diet very healthy? What are the effects on the colon? We're getting potentially predictive information here that it might not be the healthiest thing for the colon. Additionally, I am concerned with the pH elevated and the low butyrate. Is the patient constipated? Are they irritable? There's a few things to consider here and a few things that this patient's clinician can do to help them. Next case here, this is our last case. This is an interesting case as well. So this patient presented with GI distress, and this patient is on the ever popular carnivore diet. So we see this diet, it's increasing in popularity now, and let's take a look to see what the carnivore diet has done to one. Here we see that, again, microbiome abundance and diversity, we can see that this is going skewed to the bacteroides. And look at that, that is not even close to a hexagon. So diversity is definitely affected here. Dysbiosis index score of 4. So this is a dysbiotic gut. It is deviated from normal biosis. And within that one of the species that was higher was the Bacteroides sterococcus. This is within the Bacteroides group, so I apologize, I'm just going to click back here. So we see Bacteroides is higher, and then the one species within that phyla was actually the Bacteroides sterococcus. You can see that here, see? And so this species is a more virulent Bacteroides. It's drug resistant, it's potentially associated with infections, and so this is one you don't want to have high. So it's interesting to see this result. Okay, and here is actually the carnivore stool chemistry's result. So we see here the patient is like very low in butyrates, low in total short chain fatty acids, and that is going to set them up for inflammation in the colon. And what are the effects of this? The long-term effects, we don't know. So very interesting stuff here. Oh, and to note, they were on the carnivore diet for 1 month. So also, one more thing I do want to add, this occult blood here. So that's interesting to note. Is this a pathology or is this dietary due to potentially increased blood in the diet from eating red meat? Well, thank you very much for watching. If you have any questions, well, I think we'll have time for that now, but also please feel free to visit www.gi360.com.